but I chose cystic fibrosis. It's most common in Caucasians and Northern Europeans. It severely damages your lungs, digestive system, and other organs. It affects the gene that makes the mucus, the sweat, and the digestive juices. Instead of making it like thin and slippery and moist, it causes the juices, the saliva, the mucus, and whatnot to thicken up and clog the tubes, ducts, passageways, especially into the lungs and the pancreas. It may live, those affected can be anywhere from newborns to, they have it constantly, they always have it, but that gene's mutated, but the elderly may be asymptomatic until later on in life. That's why they like to test newborns, just to make sure, like, to see if they have it. That way they know ahead of time rather than later in life. These people may live to be in their mid to late 30s and sometimes their 40s and 50s. This has dramatically changed over the years thanks to technology and the testings that we do when we're for newborns. So now it's more common to have that genetic testing done in newborns in the U.S. This can help diagnose these people, these newborns, within the first month of life. With cystic fibrosis, you have a higher salt level than normal. The two systems that are mostly affected are your respiratory and your digestive system. So some of these symptoms, signs and symptoms that come with your respiratory system are you have a thick and sticky mucus that clogs the tubes, which makes it hard to breathe, so you're breathlessness, wheezy, you're exercise intolerant, you're more susceptible to infection, lung infection. You have a persistent cough that produces a thick sputum instead of a thin sputum because of that mutated gene that is affected. You also will have like a stuffy nose or inflamed nasal passageway with the respiratory system. With your digestive system, you're going to have that thick mucus that blocks the digestive enzyme from the pancreas to the small intestine, so that intestine can't absorb the nutrients from your food. You'll have a foul smell, greasy stools, poor weight gain and growth, intestinal blockage, particularly in newborns, severe constipation as well. Some tests that can be done, like I said earlier, your genetic testing when you're born. If you're pregnant or before you're pregnant, if you are just curious and you want to do a test, you can have a lab test done on a blood sample before you're pregnant. You can have genetic testing while you're pregnant or after as well. Newborn and older children, your test is going to be an immunoreactive trypsinogen. Another genetic test, and also sweat tests can be done on older children as well. Your treatment goals are to prevent and control infection that occurs in the lungs, remove and loosen mucus from the lungs, treat and prevent intestinal blockage, provide adequate nutrition. The reason I say treatment goals is because cystic fibrosis is incurable. They